Good evening. Welcome to this very special program. This is a special program brought to you courtesy of CTPD, the Center for Trade and Policy Development. My name is Saidlis Nkonjera, and I'll be here to perform the role that I'm going to be explaining shortly. Now, joining us this evening is Dr. Manda, who happens to be the Senior Researcher for Trade and Development under the Center for Trade Policy and Development. Tonight we get to discuss a very pertinent topic which you are going to get a chance to call in and contribute on this particular program and discuss as well with the doctor on the topic that is up for discussion this evening. So this evening we do discuss COVID-19 in Zambia, what is known, what we don't, and what we must do. Now, joining me is Dr. Manda, and he's joining us all the way from the United States of America. Dr. Manda, good evening.
Good evening, Said. How are you today? And good evening, viewers. I'm happy to be here.
All right. So, like I did mention earlier, our viewers do get a chance to call in and contribute on this particular episode after, of course, you do give us the information about COVID-19 in Zambia, and where we are, and of course what we need to do. So without further ado, Doc, allow me to just let you get the cat out of the bag.
Many thanks, Said, and good evening, viewers, once again. I'm happy to be here to discuss this important topic about COVID-19 in Zambia, what is known and what is not known, and what we must do. And as Said said, I'm Dr. Simon Manda. I'm joining you all viewers from United States of America. A little bit of a background in terms of what I do and my historical works. I work for the University of Zambia. I lecture in the Department of Development Studies. And my previous connection with the Department of Development Studies, I have worked on research tasks around agriculture, livelihoods, and trade. Specifically, I have taught on modules and courses related to international development, development studies, as others would call it, rural livelihoods, agriculture, value chains, and agribusiness expansion. And following my, PhD completion, I joined University of Zambia a few years ago. But at the moment, I am based in the United States of America, specifically Oregon State University, as a visiting researcher. And my work is looking at how communities interact with their environment, specifically within the context of climate change. So I'll be based here at Oregon State University for a few months before I can return to University of Zambia. I have, in the past 1 year or so, been conducting research with the Center for Trade Policy and Development, where I'm a senior researcher on agriculture and trade-related issues. And some of the works that we've done at the University of Zambia, at the Center for Trade Policy and Development, and at Oregon State University is sort of some of the elements I'll be pointing to, drawing on in order to create a broader perspective of COVID-19 in the context of Zambia, and COVID-19 in the context of Africa, and COVID-19 in the context of the global environment. And the key questions that I would like to bring to your attention tonight is, what is it that we know about COVID-19, and what is it that we don't know at the moment, and how can we evaluate policy responses within the Zambian context? From the national policy responses, are there elements that we feel should be done besides what has already been done, and what social and economic impacts can we draw, can we anticipate from COVID-19 pandemic, especially that we've seen that the COVID-19 cases have been rebounding in the recent weeks. So in this discussion with you, I just want to create more of a broader overview of COVID-19 and its social and economic implications. And you realize that like any other crisis, speculation can be common, and people would start filling in the blanks, especially where information flow is not as expected, or there's what we call information asymmetry. So from the global perspective, you realize that, a little concern that emerged in the Asian country of China has, morphed into a very big, continent or even worldwide crisis. Current statistics from the World Health Organizations have indicated or showed that over 100 million confirmed cases of COVID-19 have led to over 2 million deaths worldwide, and even more, especially that the actual statistics of COVID-19 still remain incomplete. In the African context, we find that the WHO, or the World Health Organization, report that there are over 2.6 million cases, over 24,000 related deaths across the continent. But you realize that from the broader context, from the broader continental-wide perspective, Africa seems to have been spared in terms of the public health pandemic itself. The numbers are quite incomparable if you look at Africa, compare Africa to other continents. There are many reasons that probably can explain why this is the case, but more broadly, this should not be a point where African countries rest on their laurels and give up and probably do not put the desired efforts into curbing the pandemic. I say so because of the health infrastructure and technology that still is lagging behind on the African continent, and there's need for African governments to continue putting concerted effort to curbing the pandemic, even when we see that the numbers cannot be compared to other continents across the world. In the Zambian context, the WHO statistics as of today report that we've had slightly over 59,000 COVID-19 confirmed COVID-19 cases, and maybe in the past 1 or 2 days, we've had about 1,514 confirmed cases. And, we have, as a country, experienced or incurred 812 deaths and over 51,000 recoveries. The recovery rate is quite remarkable, and I think there are a lot of factors that can explain this. And again, when you look at the death rate itself, it seems to be incomparable when you compare Zambia to countries like South Africa. But at a broader perspective, at a continental-wide perspective, the numbers of COVID-19 deaths and confirmed cases and recoveries seem to be on a lower end. Again, even within the Zambian context, we don't expect the government to relax the measures surrounding public health guidelines and aimed at curbing the pandemic. So since last year, as with other countries across the continent, you find that Zambia put in place a variety of containment measures, and a few experimentation of a lockdown in Pakue, in Nakonde, the other side. And early enough last year, we find that schools, colleges, and universities were closed. Only now are we seeing these being opened. And in the past few months, policy responses have included increased COVID-19 testing centers, alongside wider social restrictions and the like. But the key question that I would like to pose here to you viewers is that how Zambia has experimented itself with the lockdowns and other containment measures. How effective are the lockdowns, and how should Zambia consider the possibility of further lockdowns in the near future? But our recent works, actually, the critical review of literature across across sub-Saharan Africa, we find that the imposition of lockdowns really have peripheral impact in terms of on the spread of COVID-19 cases and also in reducing the casualties themselves. We are talking about countries like Congo DR, the other side. We're talking about South Africa that we can point to have implemented lockdowns, and existing literature shows that the lockdowns were less effective. And in the Zambian context, we can sort of learn from regional experiences and make conclusions as to whether lockdowns can actually help us reduce the COVID-19 cases or can help us reduce the the COVID-19 deaths. One key element to think about when it comes to some of these policy measures is the structure of the Zambian economy. We realize at a broader perspective that the majority of Zambians earn their livelihoods from the informal sector. We're talking about agriculture, we are talking about a common man by the corner of the street running a barbershop, running a salon. We're talking about someone in retail. And to get, to survive and to have an improved livelihoods for these people, they have to get out of their homes. And lockdown sometimes can restrict economic activity. And such lockdowns also can create very negative impacts, especially that our social welfare regime or policies are not wide, countrywide covering. Some people and SMEs, small to medium scale enterprises, sometimes are left out of social protection measures. So lockdowns can have social and economic implications in terms of the livelihoods of the people, access to incomes, access to jobs, and the like. And in terms of, when you look at the containment measures on social movements and the like, you can see negative implications on seasonal and migrant labor. In agriculture, for instance, we've got our brothers and sisters that engage in a seasonal or migrant labor engagements or tasks. With social restrictions, you find that these can get affected in that context. So the key thing here also to remember is that COVID-19, therefore, is not only a health crisis, it's a socio-economic crisis. Any interventions that get the health sector or that address the health implications of COVID-19 should therefore evaluated and assessed in the context of its implications on social and economic dimensions as well. We're talking about trade exchanges, we're talking about access to schools, we're talking about access to social services more widely. So any interventions that Zambia comes up with should be assessed not only in the health context, but should be evaluated in the context of access to other social and economic services. Recently, we've seen that there's been calls for vaccine, and recently the government announced that they had, secured COVID-19 vaccines, and they were due to start giving out to affected areas and the like. I think the key question to remember here is that whilst the efforts by the government is commendable in terms of securing the vaccine for the country, there still remains questions around the COVID-19 vaccine. So far, we don't seem to see a worldwide acceptance of COVID-19 vaccine. Of course, we're still in the early days of the vaccine, and the vaccine might have teething problems. But within the Zambian context, the government and other stakeholders will need to explain and sensitize the public in terms of the implications of the vaccine and what we are expected to look out for. As well as the, adding to that point, you realize that at the moment, the vaccine still, faces a challenge of availability. It might be available in other countries, but it still remains costly for poor countries across Africa, including Zambia, especially that this, is coming at a point where economically most African countries are struggling. So the vaccine might be available, but it might not be accessed by many African countries, Zambia includes. In fact, recent estimates by the World Bank indicate that probably the vaccine would be available more broadly by 2023. meaning that individual countries will have to put in place concerted efforts to access it. So a vaccine might be available, but might not be accessed due to financial and other challenges. But also in terms of its utilization and its effects, we need a bit of sensitization in order to, to prepare the minds of Zambians and the wider population across the continent in terms of the implications and what we should expect from the vaccine. And the key question here that I wanted us to draw our attention to would be to ask, what should we do as a country? Are the existing efforts that Zambia has put in place sufficient enough? I think it's a very big question, and in our conversation, I think it will be important to interact and share views from wherever you are, whether you are in Chadiza, whether you are in Nakonde, Kafue, Mgubudu, Chanje, Lundazi, Zambezi, Chavuma, and anywhere across the country, we can share the views in terms of what you think the government has done and whether this is sufficient enough. But I think from my perspective, I can start with the fact that I think the country requires a national COVID-19 task force, and we feel that this is very urgent. The task force should not be monosided, composed or comprised of the medical professionals and the like. It should be multidimensional. Remember, we mentioned earlier on that the pandemic is not only a health-related crisis, but it also implicates social and economic dimensions across the country. And I think a national task force supported by high-level government units is needed in Zambia. And this task force will have a whole variety of functions, as I'm going to explain later on. The second thing that we should do as a country, I think, is to increase adherence to public guidelines. And kindly note that I'm not calling for a total lockdown of the country for reasons that I've already explained, that the structure of our economy is one that is anchored on the fact that most, majority Zambians have to get out of their homes to survive. They have to get out of their home to get to their workplace. They have to get out of their home to run their small to medium scale enterprise and the like. So increased adherence to public health guidelines, very important. The other component that I would like to mention here is maybe there's need for improved COVID-19 communication. There is need to manage COVID-19 crisis communication. And this improved communication in a way can help us get, very important information about COVID-19 at the right time. And you find that in the absence of a clear-cut COVID-19 crisis communication, the citizens of Zambians are bound to start filling in the gaps. And filling in the gaps in a crisis like this is not good, because it raises speculation and the like. At the moment, we can get information from each and every angle, and I think in the digital world or in the computer world, this is inevitable. But we should be able to centralize communication to avoid panic and to avoid speculation and filling in the gaps. And I should mention that the viewers, you are very free to send in your comments and your views. And then the number that Said had communicated is 0764 25 0055. And you can use that line to share your views and perspectives and the like. The other point that I would like to bring to your attention is maybe Zambia requires or needs to create conditions which allow Zambians to go to work and maintain their livelihoods. I've already alluded to this fact, but I think it's somewhat of an emphasis. We are looking at the informal sectors, we're looking at small to medium scale enterprises. These, the Zambians engaged in these sectors require protection, socio-economic protection in order to survive. After the crisis, we should survive, after all, as a country. Said, I'll bring you in case you have any views that you would like to share before I can proceed.
All right, thank you very much, Dr. Manda, for that. It is interesting, really, to see the number of points that you've listed, and of course to see the strategies that you're advising, such as the creation of a national task force, to help with the pandemic. Now, our government here has, done quite a number of, embarked on quite a number of interventions, but of course, like you're suggesting, I think a national task force that is multidimensional in nature is one that would really help. Mine this evening will be to allow you, our viewers out there, to call in. Like the number is 0764 250055. That is a number that you can call in and to speak to the doctor. What is your say on this, particular episode? And also remember that this program is brought to you courtesy of CTPD, as well as the OSISA, that is Open Society Initiative for Southern Africa. Do call in on that number and you'll be able to get through to studio and to talk to Dr. Manda, who's joining us from the United States of America. Doc, you did say that we need to increase adherence to COVID-19 guidelines, but of course not forgetting that there are people who need to feed. There are businesses that need to run. It has been a very difficult, decision to make here in Zambia, because at the end of the day, some families have to decide to either, starve or to just go out there and face COVID-19. The government has also been a bit reluctant in terms of the measures, because most of the measures might mean, locking down on that would have a huge economic impact, as most businesses would come to a standstill. So I want to just get your idea of how Zambians can still, operate amidst the COVID-19.
I think what you've mentioned, Said, is a very important point, and I can sympathize with the government that this is not going to be an easy call. And this relates to the fact that this crisis is unique. It's not entirely a health crisis. It's going to be a financial crisis. It's going to be a social and economic crisis more broadly. And you're right. Some Zambians, our brothers and sisters, have to make a tough decision of going out there and risk it all and face COVID-19, or stay at home and starve and run out of supplies and the like. And some of our brothers and sisters must survive a day at a time. And any futuristic planning is very difficult at a household level. But the key point that I wanted to sort of bring to your attention, as well as the viewers, is that there is need for the country to interrogate the COVID-19 statistics. This is very important for us to understand what the pressure points are. Are COVID-19 statistics or numbers rebounding because of primary schools, because of secondary schools, because of colleges or universities? The answer to that is not known. Are the COVID-19 cases rebounding because of people interacting in the markets? What are the profile and demographic background of the COVID-19 cases themselves? This information is less known. So we feel like it's very important to interrogate the statistics, not only for anything else, but for the fact that it helps the government to make critical decisions and which sectors should be targeted. At the moment, you realize that there are two platforms for testing that seem to be available in Zambia. And from the medical perspective, there's what they're calling the antibody test and the antigen test. But these tests combined have their own challenges and weaknesses from the medical perspective. But again, when you look at the statistics in Zambia, it's very important to understand which of these seems to be widely spread and which of these seems to be bringing out certain results, so that we have an understanding of the interpretation of the results themselves. So we think that there is need to interrogate the statistics themselves in order to create a clear picture of what COVID-19 pressure points are, the profiles of those we are losing, and the sectors that seem to contribute much to the COVID-19 picture. And this requires me to point to another point, say that there's need to to enhance sensitization. And if you're going to have a national COVID-19 task force, you must deal with the doubters of COVID-19. We still have our brothers and sisters, some of our brothers and sisters who sometimes might doubt the very existence of COVID-19. And this requires more sensitization from the government and other key units and within the government, NGOs or civil society organizations. So it's a tough call to make, but it has to be made in order to balance not only the health interest, not only to protect the public from the COVID-19, but also to ensure that our brothers in small to medium scale enterprises, our brothers that must get out there and survive, should be able to maintain their livelihoods. And I feel that, I believe that any substantial economic recovery would stem from the fact that we are able to maintain local livelihoods, trade exchanges, and the like. Back to you, Said.
That information, of course, as we continue sharing to you that is watching us, the number to call is 0764 250055. You can ask any question concerning the COVID-19 pandemic in Zambia, where we are and, what we need to do as, and what other questions do you have concerning, the COVID-19 pandemic. Doc, allow me, as we wait for those phone calls, to just ask you a question bordering around COVID-19. Now, one of the anticipations that the world had was, that a vaccine, would be developed. Vaccines have been developed and have so far, been deployed and are in use. South Africa did just a few days ago receive its first batch of, 1 million doses of the COVID-19 vaccine. Now, there has been apprehension, I will say, from most parts of the world on how, this vaccine or the efficacy of it. And I would want to get your opinion, because back home, this is what is making, conversation. Others suggesting that, those in leadership need to take this vaccine themselves first before it is distributed to the people. But maybe before we get to the vaccine, allow me to bring in the viewers so that they engage in various, in this conversation. Hello, good evening.
Yes, how are you, sir?
I am very fine, thank you, sir. Your name and where you're calling from?
I'm calling from Kabwe. My name is Gladson.
Your name again?
My name is Gladson Snuff.
Gladson.
Yes,
All right.
In Kabwe.
All right, Gladson, you're through to this special interview, and you'll be talking to Dr. Simon Manda, who is joining us live from the USA. Go ahead with your contribution.
Yes, now I want to talk to Bemba. I don't know if you can understand. I want everyone to understand. I don't know if you can allow me.
Dr. Manda, balefo kumfya chibemba mulomfa.
That's fine, I'll try.
You can go ahead. You can go ahead.
I'm sure, by the way, but I'll try.
Okay.
All right.
Okay. In a cheap pushing. Bonse Zambia tapadi winga fire ukufwa. Bonse tu fire uvumi ubusuma. Nomba prefire imwe womuchitire research. Bushe, are you sure kuti ngacha kuti batuchita vaccinate that wakafwe? Ero I'm making sure kuti batuchita vaccinate that wakafwe. If we do ready to vaccinate, because the party is not going to winga for but you have put negative videos not to put it allow. Number question, are you sure that the vaccination is ilipo? Yakutu for famous Zambians won't say, because what a question mark hearing that for once in Zambia, ukwambo kutuishika, because and this scandal, that's why the old Zambia were Tina. But we are ready. Number, are you sure that vaccination you are going to pay for once in Zambia? If we know, we are ready.
All right.
So, a question you on the farm.
Gladson. All right. I hope you did get that, Doc. So, Gladson from Cabo is saying that no one wants to die in Zambia, that everyone wants a good health. And his question is that to you that have done research, how much, you know, how sure are you that the vaccines that have been, created so far are going to cure COVID-19 and that are not going to cause death? And also he says that this is because of the health scandals that have rocked the country, Zambia. And he's got a few questions. But before you answer that one, you can just take note. Allow me to bring in another caller. Hello, good evening.
Hello, good evening.
Good evening, thank you. Your name and where are you calling from?
I'm calling from Kavuma. My name is Abdemba Likereng.
All right, go ahead with your contribution. I'm with Dr. Simon Manda.
I don't want to know the difference between the ordinary flu which we used to battle and the corona, because one of my neighbors, he had the flu, he went to the hospital. I protected him and he has recovered from that flu which he had. The result which came, they said he had corona, but now the person is okay. And he has been moving around.
Okay.
So I want to know the difference between flu and corona.
All right. Thank you very much. Okay, so we'll allow another 3 more calls before the doctor can, respond collectively to the many contributions that are coming through. 0764 250055 is the number that you're calling to get through to studio. Hello, good evening. Hello, good evening. All right. Hello, good evening.
Hello, good evening, sir.
Good evening, thank you. How are you and what is your name?
I'm fine, and my name is Mr. Chimba.
Mr. Chimba, where are you calling us from?
I'm calling you from Dola.
All right, Mr. Chimba, please go ahead with your contribution. We're joined by Dr.
Yeah,
Manda. London, Chimba.
And they contain actually a vaccination.
I'm quite.
Doctor, but some vaccine you.
All right.
But normally, as soon as I'm the research tropical diseases research center, Dola. We should have to by some scientists. We should connect the scientists so that now was initial vaccine. Yes, I want to use Zambia.
Okay.
And to cheap and simulation at your park, imitation is a free watch research.
I'm quite.
Yahweh, we will church in government, we will transmission to
All right.
So I want to doctor, I start communicating the tropical disease research center.
Okay.
That was there.
All right. Watasha Kwaiba Chishimba. 0764 250055 is the number that you are calling. Hello, good evening. Good evening, wise man. How are you this evening? Very fine. How is Cabo? All right, please. All right, Doc, wise man is talking to you.
I've got 2 questions for the doc.
Sure.
Yeah, the first question I want to find out from the doc is that can COVID-19 be transmitted by mosquitoes?
All right.
If a mosquito bites someone with the COVID-19, then it tries to bite me as well. And if someone was with the COVID-19 maybe so then the fly goes on that thing which that one has then comes to people. How safe are we coming to the vaccine issue where we saw now in our country the health sector when it comes to Ministry of Health is not stable. This organization being dissolved, we can start fighting this one. How safe are we ensuring that whatever we are receiving concerning COVID-19 they are coming in the footsteps of the Zambian people?
All right. Thank you very much, wise man. We'll pick up a final call for this set of calls, and then I will allow Dr. Manda to respond to these many questions that are being posed this evening. 0764 250055 is the number you're calling. Hello, good evening. Hello, good evening. Hello, good evening. Hello, good evening. All right, your name and where you're calling from?
Good evening, thank you.
All right, what is your name and where you're calling from?
I'm Pastor Kamayan calling from Kasepa.
Pastor who? Can you come again with the name?
Calling from Kasepa.
All right, Pastor Kamayami.
Yes, please.
All right, please go ahead with your contribution, sir.
Yeah. Doctor has alluded to the very fact that the vaccine is safe for us as Zambia. But other information telling us that even the president of the vaccine has refused to be vaccinated. How safe shall we be? This vaccine, the vaccine which was made by the person himself, also needs to live. That he wrote over to the world that he himself refuses. How safe is that?
By he, who are you referring to? All right, thank you very much, Mr. Kamayami, for that contribution. Doc, I have, a number of questions that we've collected from, viewers across the country. I hope you took note of some of them. And I will start with the first caller from Kabwe, in the name Gladson, who said that no one wants to die, but is concerned, with the various scandals that have rocked the nation with regards to the Ministry of Health. And now he wanted to find out how sure you are of the COVID-19 vaccines that have been, developed so far.
Yeah, thank you so much, Said, for that. And the thing is, question coming from Garson from Kabwe. And I think I should mention from the outset here that I am not appearing or discussing these views as a defender and advocate of the COVID-19 vaccine. I am also learning about this just like anyone else, and the information around the vaccine still remains scanty at the moment. But like any other vaccine, there would be negative and positive reactions to it. Pfizer, who probably are the pioneers of the widely spread COVID-19, have advised or have reported that there is a 95 efficacy rate of COVID-19, and I think they are also learning as they go. But I think the most important thing is to for Zambia and its experts to look at this vaccine and conduct their own trials. It reminds me of when we were growing up in primary school. We would have vaccines on our arm, in primary schools and the like. And some would get swollen, others will not react to it, and many more reactions to the primary school vaccine we used to receive. So I expect that it's expected that there will be different reactions to the COVID-19 because our bodies differ, and when we introduce an external, body into our, bloodstreams, bodies will react differently. But just to ensure our own safety and not knowing what we are giving to our citizens, I think it's important for the government to also put in place their own measures. And I think what you've said, Garson, relates to what Mr. Chishimba talked about, the research centers that we have in Zambia. And it's very important that any task force that is going to work on COVID-19 is supposed to work with existing institutions in Zambia to ensure that the trials or any tests are conducted. But some of these institutions would suffer from poor funding, poor staffing levels, and the like. But it's very important that we conduct our own tests on these vaccines. We, as Zambians, have to start writing our own history. We have to tell our own stories. We have to narrate our own experiences. And by entrusting such institutions we can do a good job. Said, I missed the other questions. If you can come in.
All right. So we did have a question coming from Chavuma, where the caller was asking the difference between an ordinary flu and the coronavirus, because someone close to the caller had normal flu symptoms, and then was later on tested. The person tested positive for COVID-19, and he was walking freely among people because he didn't have the severe symptoms of COVID-19. So they wanted to find out the difference between this.
Yeah, thank you so much for that. And I think the caller from Chavoma is bringing out a very important element we discussed earlier on. In the absence of adequate information, in the absence of a very clear-cut COVID-19 communication strategy, citizens or Zambians will start filling in the blanks and they will be speculating. At the moment, I will not speak really from a medical background, or what we are relying on are what we're calling COVID-19 symptoms. And we are told that some people would be asymptomatic, like they will have the COVID-19 virus, but they would not show the signs, or they would not show the symptoms of being unwell. And I think that's what's going on, because at the moment we don't know which flu relates to COVID-19 and which flu is probably related to this seasonality in Zambia more broadly. So I think the key point there is that we are all filling in the blanks, and without a clear-cut sensitization plan, without a clear-cut communication, COVID-19 communication strategy from the ministry and the like, it becomes very difficult for us to understand what's going on. And very importantly is the point we mentioned earlier on. It's important to interrogate these cases. It's important to interrogate these statistics for our own planning as a country. Said.
Thank you very much, Doc. We did also have a number of questions coming from Kabwe. Wiseman did ask, can COVID-19 be transmitted by a mosquito, or can COVID-19 be transmitted by a fly? Say, someone that has COVID sweats or any liquid, a fly sits on any liquid of any fluid of somebody that had COVID-19 and then sits on someone's food. Can then that lead to a transmission? And he also did ask how safe we are. He was making reference to what the other two callers did.
Yes. I think thank you, Wiseman, for that. It's a tricky question, and also it points to the fact that we need more information about the virus. At the moment, we seem to have been told that the virus is transmitted, human to human, and the virus can only stay in the open space for just a small period of time. And I have not come across any research or literature that points to these other transmitters, mosquito or flies. I am yet to read about that, but so far we know that we've been told that it's more human to human. Said.
One question. This one was asked by Mr. Pastor Kamayami, who did ask a question. This is, information that has been propagated by, several online platforms to say the funders of the COVID-19 vaccine, and they've actually named them, have refused to take the vaccine. So why should Africa or Zambia in particular be the ones to take the vaccine? So this is some misinformation outside.
You're right, Said, and I think what Pastor Kamayami has said is very valid in terms of, or it's very instructive in terms of how much information is needed there. And again, we reiterate the fact that we need a clear government communication plan about what's going on. Again, you're right that the wider acceptance of the COVID-19 is yet to be achieved, even in the US or in other European countries. we still have a section of the society that don't believe in the vaccine. And I think it's a role of the Ministry of Health, it's a role of our government officials to clearly explain what this vaccine is all about and its implications. But we have seen public officials elsewhere in Europe and in the US that have volunteered themselves to receive the vaccine. And so far, it seems to be working. And in the Zambian context, we just need more sensitization and more information on that. The other thing that others are trying to grapple with is the fact that we seem to have registered lower numbers of COVID-19 deaths and a high number of COVID-19 recovery rates. And to some commentators, they say that this might not justify a policy position of the vaccine. But whichever the case, and I think it's important to have a clear plan from the Ministry of Health and the government on what this is all about. But elsewhere, some public officials seem to be taking it, and it seems to be working thus far, irrespective of the challenges that we seem to be facing. Maybe these might just be teething problems, but more information needs to be sent out there. So,
all right. You're watching the special edition of Unscripted, and this evening we are joined by Dr. Amanda, and we're discussing COVID-19 in Zambia. What is known, what do you need to know, and also what we must do. The number that you're calling in is 0764250055 for you to be able to ask that question or contribute to this on this particular platform. So 0764250055 is the number to call. Like I did say, this program is brought to you courtesy of the CTPD, as well as or CISA. So these are some of the contributions that you're going to be talking about. So 0764250055. Hello, good evening.
Good evening, sir. How are you?
Very fine, thank you. Your name and where you're calling from?
Okay, my name is Farai. I'm calling you from within Lusaka.
Your name again, sir?
My name is Farai, calling you from within Lusaka.
Kayoyo.
Farai, F-A-R-A-I.
All right, Farai, please go ahead with your contribution.
Okay. First and foremost, I would like to pass my greetings to Dr. Manda and inform him that we meet him as the Onza community.
Awesome.
And then,
thank you.
What I would like to find out from you and the daughters, how much do you think our Zambian government is working hard to sensitize the numbers of the rural population on how best they can keep themselves safe and protect themselves from spreading better this pandemic? Because one thing that I've come to notice is that the urban areas, at least they have a bit of information here and there, but what is happening in the rural areas is quite contrary, and it seems to be something that they do not care about, and there is zero presence of the COVID-19 pandemic in the rural areas.
All right, thank you very much, Farai, for your contribution. All right, 0764250055 is the number that you are calling. Farai asks a very important question, Doc, that, the rural areas probably have some bit of information, but what happens in the rural areas do not have, information, or there's misinformation, and he's questioning how much you think government is doing in sensitizing the citizenry on COVID-19.
Yeah, thank you. It should be Kayoyo for that question. I think you are right. We just completed a research, recently. We're trying to look at the perspective, rural perspective of COVID-19, and you realize that the sources of information for most of our rural dwellers, rural brothers and sisters is, from a friend, or we heard from the friend, or we heard about COVID-19 from the church. and other informal sources, and there's a lot of miscommunication. And also with the rural-urban divide, you see that the public conduct is different. In urban areas, Zambians seem to be on top of the game in terms of access to information, maybe because of social media and the like. But in the rural areas, when you visit the rural areas, it feels like you're visiting totally a different country, but within one environment, or within one context, which should not be the case. And again, it points to the fact that we need a clear-cut strategy for sensitizing our citizens, both in the rural and urban areas. And you find that even when we had lockdown, some rural areas went on with their even when we had strong containment measures, social restrictions and the like, the rural areas seem to have continued their lives in agriculture, their lives in trade and the like. So I think we need a more of a holistic approach to the way we view and intervene in COVID-19 pandemic itself, as opposed to sort of being biased towards the urban areas. More support is very, very much needed for the rural areas as well. And I think I agree with Kayoyo's sentiment. Said.
All right, I do have a text message that is coming through. This one says, "Good evening, Dr. Manda. I'm really following the program. My question is, my nose has blocked. Also, I have lost sense of taste. What could be the problem? I'm worried." This is coming from Prosper Mwamba from Kapirimposhi, Zambia.
Yeah, thank you for that. And I should mention from the outset, that I might not speak really from a medical background or medical. I might not give you medical advice, but I think it's important to appreciate the fact that these symptoms sometimes might appear for different sorts of reasons, and the only way we can gauge what it is to sort of get a taste of it. Blocked nose, loss of sense of taste sometimes can be caused by a whole variety of reasons. But again, I'm not commenting from a medical background. I think I can just advise that you quickly get yourself a test. And the most important thing is that, like any other pandemic, panic can send us into different wrong directions. But the most important thing is for you to get medical attention and sort this one out as soon as possible.
All right, Doc. We have about 5 minutes, before we wind up. Zambia did in the education sector. We did open schools on the 1st of this month. Now, prior to that, there were huge concerns with regards how much information the little ones have concerning COVID-19 and how well protected they are. What would your advice be now that schools have gone ahead and opened?
Yeah, thank you, Said. And I think the key point that is coming out from what you're saying here, again, points to how we have interrogated our statistics. It's very unclear whether the pressure points in primary, secondary schools or colleges or universities, we have just closed these institutions without prior understanding of whether these are drivers and whether these are the pressure points. I think opening the schools is a commendable job, and I think from my own assessment, this was long overdue, and I think the closure itself the closures themselves might not have been driven by adequate information about the fears of COVID-19 and where the interventions should have been. But I think as we open the schools, it's very important that there are different layers of COVID-19 effects. We're talking about how do we protect our teachers who are giving a lot for our children. How do we protect the children themselves And in some cases, the children are interacting with their schools, coming from home, and then they go to visit their schools and then interact with their teachers. I feel it's very important for the Ministry of Education to have school-based interventions that can protect our teachers and also protect our children. Most importantly, do a countrywide assessment as to how or whether the COVID-19 is coming from the schools, the school environments, and then respective interventions to be put in place accordingly. Right.
Few more calls, just maybe two before we wind up. Hello, good evening.
Good evening.
Evening, thank you. Your name and where are you calling from?
Gloria is my name.
Gloria, where are you calling from?
I'm calling from Uganda, Soccer.
All right, Gloria, go ahead with your contribution. I'm joined by Dr. Manda.
Okay. I'm following the program closely.
Sure.
And just a contribution, I think, from my part. I really feel even us as citizens really have a role to play in as much as COVID-19 is concerned. If I take an example, for example, you take a walk and go to places like the water market, you really find that people that are even wearing masks are very few. And the few that are wearing them, the same mask, are wearing them wrongly. You know? Instead of the mask covering the nose, the mask is there covering the mouth. So in this particular case, I really feel we really need the most that has to be done to fight this pandemic. And effort has to come from both the government and the people at large. So we need to put our heads together. The government, the people at large, we put our heads together in order for us to fight this pandemic. In as much as, yes, it has affected the economy of the country negatively, wherever it is, I think the economy is really bad already, and then with the pandemic, it has really made things really worse. And then we are saying, fine, we cannot close the economy because our means of survival, for some of us, we find that it's a day at a time, as Doc said. So we really need to hustle on a daily basis. And so the most important thing probably would be the desensitization, as the earlier caller had mentioned. It's not just people in the rural areas. I think even us in the urban areas, we need that sensitization. People really need to know the dangers of COVID-19. Because some probably are still doubting if we had this COVID-19. But the fact is COVID-19 is real. And we really have to fight hard. We put our heads together. The government, the citizens at large, we put our heads together to fight this pandemic. I think that's my contribution. Thank you, Doc, for the information you're giving. I think it's a very good program. Thank you.
All right. Thank you, Gloria. I'll pick one last call. The next call is our final call as time has, elapsed. 0764250055 is the number that you are calling to get through studio and add your voice to this conversation. Doc, the previous contribution, I hope you did hear from Gloria, where she's saying that the community itself, the public, needs to do more in preventing COVID-19 and not only wait upon government. The government's role, yes, will be on sensitization, but also implementation is very key on our part as citizens.
I think I agree with Gloria on that point. There are people, our brothers, some of our brothers and sisters seem to be pulling in a different direction in their social gatherings, in their churches, in their everyday businesses. They're not adhering to some of these guidelines. And I think if we're going to tackle this pandemic, we must speak and act with a collective mind. We should pull as a country in one direction. And as well, the government should be able to provide that direction, and each and every one of us should respond accordingly. And I think the sensitization and the clear communication strategy will help to gather support to move in a given direction. And I think I agree with Gloria on that point. Said.
All right, Doc, it's been a great evening. We'll have to ask you to give your, concluding remarks as we wind up this program.
Yeah, thank you for that. And thank you for viewers that interacted with us. I think I should just want to reiterate the fact that the pandemic doesn't seem to give indication that it will go away in the next few months. The pandemic is real, and I think that the pandemic also has shown that there will be certain things that will be very important at a country or national level context. And Zambians, together with the Zambian government, should be able to pull in one direction and realize that this is not only a health crisis, but also a social and economic crisis. The call for a national task force is very important and urgent, and this should be able to control communication of information, sensitization, and the like. And I think if we pull in one direction, we'll be able to see a change. Interrogating of our statistics, very, very important, which is very important not only for policy, but also for understanding where the pressure points of COVID-19 are in Zambia and where we can intervene as a country. Thank you for having me, Said.
All right, thank you very much, Doc, for having time for us this evening. Well, viewers, this is where we end our program this night. I was talking to Dr. Simon Manda, who happens to be a senior researcher for trade and development under the CTPD as well. Bringing this program courtesy of CTPD and the Open Society Initiative for Southern Africa, or CSAT. And also, tonight, we were talking about what is known about COVID-19, what is not known about COVID-19, what do we need to do, or what are the next steps that we need to take. Very thankful to you, our viewers that did join us via Facebook, YouTube, as well as those that watched us from the decoder and did manage to call in or send an SMS. We are grateful. Good evening.